Hello, you're watching The UK Tonight here at University Hospital, Coventry and Warwickshire for a special programme dedicated to the NHS. Strikes, waiting lists, persistent staff shortages, the health service is straining at the seams. At 75 years old, the system designed to care for us all from cradle to grave is now itself in need of urgent care.
The NHS is in crisis, from GPs to hospitals, ambulances to long-term care.
The NHS must work to bring down record waiting lists. Pressures for the NHS are here and now.
Junior doctors and consultants in England have begun their longest ever joint strike.
They've come to the table with nothing.
Strikes have resulted in countless cancelled appointments.
You're watching NHS Crisis, You're Safe. Rod Stewart, good to hear from you this afternoon.
I would like to pay for 10 or 20 scans. Now, I just want to do some good things.
No one can doubt our commitment to the NHS. Record sums invested.
We've got complete failure on the government on this front as well.
Almost every part of the health service is under huge strain.
Unless it gets the urgent help it needs, there is no certainty it will be here in the future.
Well, good evening to you from University Hospital, Coventry and Warwickshire, where 3 years ago, almost to the day, the world's first COVID jab was administered. Since then, waiting lists have steadily climbed, now reaching a record high, with millions of people waiting for treatment. We've seen a year of disruption from industrial action, causing more than 1 million appointments and operations to be cancelled. And there is more to come, as junior doctors will walk out again before Christmas. Tonight, we'll be hearing from frontline staff here in Coventry about the challenges they face. And I'm joined by a panel of experts to answer some of your questions and get their diagnosis of the problems facing the NHS and, importantly, how to treat them. Siva Anand-Siva is Chief Analyst at the King's Fund, a health think tank which has been working with Sky News for the entirety of this year, and Professor Dame Helen Stokes-Lampard. She's a GP right here in the Midlands and a senior health leader, formerly at the helm of the Academy of Medical Royal Colleges. We're going to get their thoughts in just a moment, but first, I've been spending the day here at University Hospital Coventry, speaking to some of the people who are the beating heart of this hospital, the people behind the scenes who keep things going. I want to give me a flavour of what it's like to be here on the maternity unit at the hospital.
It's a really nice environment, especially around Christmas. It's a healthy ward, so people are happy to be here and they're getting ready for a really exciting event, so it's nice.
How tough has it been through COVID and through the other external pressures and internal pressures on the NHS? Because, you know, not just COVID, the general pressures on the NHS in terms of waiting lists and things like that, and of course going into this busy winter period. Just how pressurised is it to work at the hospital?
Pressures are really difficult, especially with things like staffing or kind of having cots, things like that. I work specifically in a team that looks after unwell women, so that are needing high dependency care. So we see kind of influx as well around the winter months as people are getting colds or infections that they are aggravated by pregnancy. So it's difficult, but I wouldn't do it if I didn't love it.
So Ross, tell me about hospital at home.
So essentially our goal is to treat patients that would otherwise need to be in a hospital bed in the comfort of their own home, which is much better for both the patients and for the hospital. And
what kind of difference has it made? Because we talk about bed capacity in the NHS, particularly at this time of year. So what kind of difference does your scheme make?
Yeah, so currently we have over 40 patients on our hospital at home, and that's over the capacity of an entire ward. So that is vastly important to the hospital in terms of creating those beds, being able to create movement through the hospital and free up space in the likes of A&E. And it's also really important for the patients as well.
Yeah, it helps with recovery, doesn't it? If you can be treated at home and you go out into the community, treat people at home, because otherwise the option would be to be on a ward for weeks, if not a month, when they come in now maybe weekly, twice weekly. And Mark, I know that you're a beneficiary of this, because if you weren't coming in every week and seeing the hospital at home team, you'd be on a ward.
Oh yes, absolutely, yeah. I mean, the hospital at home is a game changer for me. So rather than taking up a bed here, I'm now getting treated here, but I'm only coming in weekly rather than being in here 24/7. So for me, it works really, really well, because I'm actually now back at work.
So Faye, you've worked at this hospital for over 20 years, so you've seen it change hugely in that time.
I have, yeah. I started working in this building in 2006 when we moved over from the old hospital.
So you've always been involved in catering.
Yeah.
You could serve as many as 3,500 meals a day at this hospital. It's a huge operation, isn't it?
It really is.
What does it mean for you to work for the NHS? Because when you think of the NHS, you think about the doctors and nurses, but it's the team behind the scenes, like the catering team, and there's a real sense of pride and teamwork that goes into it. What does it mean for you to work for the health service?
There is definitely a sense of pride. It's really nice to have that I'm giving my something back. It's a good job. It's varied. Every day changes. Obviously, there's, we might not have something here, and we have to supply something, we have to find something. And the patient's experience is what we aim for them to receive a decent meal at the end of it. We want them to be able to go home and say to their family, actually, it wasn't as bad as the hype.
Now, at the start of this year, the Prime Minister made cutting NHS waiting lists one of his 5 promises to the country. But as the year has gone on, they have continued to climb, reaching a record high as millions of people wait for their treatment. People are waiting to see GPs, they're waiting for ambulances, they're waiting in A&E and waiting for planned care. And a year of industrial action has only added to those backlogs, with more than 1 million, some health leaders are saying closer to 2 million, appointments and operations postponed. Well, let's take a look at the headline figures for those who are waiting for planned care. Waiting lists have hit a new record, with a list to start elective care rising to nearly 7.8 million in September. Some people are waiting for more than one procedure, so the total number of individual patients waiting for treatment is 6.5 million. And as you can see here, since Rishi Sunak made his promise to cut waiting lists, they have in fact steadily grown. Well, let's now bring in our panel, Siva Anandasiva and Helen Stokes-Lampard. Good to see you both. Thank you so much for joining us here in a training room at the hospital, just in case people wondering at home why it's not busy behind us. We found the spare beds, but they're actually in the training room. Let's talk about those waiting lists. Siva, some startling statistics there about the fact that they are steadily going up. That's the overall picture. Why are they growing?
So I think you're absolutely right. That waiting list for routine procedures like knee and hip operations are continuing to climb. And I think that's for 2 reasons. One, increased demand. So our population is growing, our population is aging, so there's more demand on the health service. But I think the key constraint, the key reason is supply. Are there enough staff? Are there enough beds? Is there enough equipment to meet this rising demand? And I'm afraid the answer is no. So that's why, despite the Prime Minister's pledge, waiting times have continued to increase. There has been some good news. Some of the particularly long waits for care, some of the waits that were 2 years or over have reduced. But fundamentally, when you look at how long people are waiting for care in this country, I think you're looking at years before the performance standards are routinely met by the NHS once more.
David, when we talk about waiting lists, we're not just talking about for knee and hip operations, the planned procedures, which are postponed because, surgeries go to priorities, those that need it most. That's just the nature of how the health service works. We're also talking about waiting lists for GPs. We're talking about waits for ambulances as well, waits to be seen in A&E. What are some of the causes that are feeding into those waiting times?
Yes, and the headline figures that we talk about, that sort of 7.8 million people waiting, that is for hospital care, that is for diagnostic tests. That is nothing to do with the community stuff, the waits for a GP or a dentist or for nursing care. And those things aren't measured in the same way. So we don't count them in the same way, so we don't know. And yet anyone who's tried to get an appointment with a dentist or a GP does understand the difficulties. And so we've got many causes of it. It's not simple. And these things were building long before the pandemic. We referred to the pandemic tonight, but there were problems before, at that point, as we went into the pandemic, there were over 4 million on the hospital waiting list, and the system was creaking anyway. And so what we've had is a long-term period where the NHS was underfunded. Now, the funding at a superficial level, now, as I'm sure Siva will tell us, is at a much better level. But we've got this decade of underfunding, which has led to fewer staff than we needed, fewer beds than we needed, fewer premises or inadequate premises compared to what we need. And those have cumulative effects. If you haven't got people coming through the training pipeline, if you haven't got the equipment where you need it, you end up with the challenges we have now. And whilst we can't undo the past, we absolutely have to work from where we are going forward. I think being honest with the public about the state of the NHS that we have now, and the state, what the NHS we want it to be, and what those compromises might need to be in the future, I think are very real and an important, quite sophisticated debate actually, but one I think the public is ready to hear and engage with. What they don't want are trite lines suggesting everything will be marvellous and simple things are going to fix it, because they're not. It's complicated.
And they know that because they're experiencing it, and people have been getting in touch with us. This is from Kira. She says, my husband has prostate issues. The waiting list to be seen is 13 months. That's just to get an assessment, Kira said. He spent £8,000 to actually be treated privately, and he was seen within 6 weeks. And Kira says that she's been waiting for hernia surgery since last February. Now, Siva, the public know the effects of the waiting list because that's their day-to-day reality. They're living this. But it's quite interesting that those that can are going private. And, you know, we're seeing suddenly this option for people that can afford it to go private and skip that waiting list. And that starts to create a real divide, doesn't it?
Yeah, absolutely. And that's why people are increasingly talking about a two-tier health service in this country. And just to say, the long waits are driving a lot of this behaviour. You know, before the pandemic, there were under 2,000 people who were waiting over a year for care. So that wouldn't be a real drive for you to go private if you had the means to do so. Now there are 390,000 people waiting over a year for care. I was talking to one hospital chief exec, and she said, you know, 5 years ago, she knew the name of every single person on her books who'd been waiting over a year. That's how much of a low frequency event, how important it was. So absolutely, people with the means to do so can choose to go private. But the problem is, this is not how we designed healthcare in our country. The way we set up healthcare in our country is we have a national health service, comprehensive, free at the point of use, that is there to meet the needs of the population. If you have the means and choose to go private, yes, that facility is there for you. What we're seeing now from the data is people who don't have the means to do so are increasingly using crowdfunding campaigns, dipping into savings they were using for another purpose. It's no longer a choice to go private. It feels like a necessity. And that's not what the NHS was set up to do.
Well, to get a sense of what it's like managing those waiting lists, a little earlier I spoke to Robin. Now, she's a ward sister in the elective surgery ward, and she told me what it's like there. So, Robin, give me an idea of just how busy you are on the ward today.
So today's been particularly busy. We've had lots of patients come in this morning for not very many beds. So we've had to prioritise those with clinical need and things like that to be able to get them all in. So yeah, I've been quite busy today. We had a lot of patients that stayed from yesterday overnight, so then that impacts the following morning. So this morning I think I came into 12 patients for no beds and one potential discharge for going home. So yeah, we've had to do a lot of swapping and changing today to get everybody in.
I was going to say, what happens with that? Because we talk about waiting lists a lot. Effectively, you're managing that and you're having to try and work your way through this waiting list. Just give me an idea of how you're dealing with that.
So from a ward point of view, we have to prioritise the patients largely on clinical needs. Waiting lists do play a factor, but a lot of these patients have been waiting for a long time. So it has to then, you have to then bring it back to the clinical need and who's most urgent to have their procedure done today.
Yeah. So you'll get a lot of patients in here who have been waiting. When you say a long time, what do you mean by that?
So it varies from talking to the patients. Some have really positive experiences and are waiting not an awful long time.
So again, it depends on need, right?
Yeah, so I spoke to a man this morning. He said, but from a diagnosis, he was in sort of within the 3 months, which is what we aim for, particularly with like cancer pathways and things like that. Other patients have been in a couple of times and have been cancelled, sent home, and then have to be rescheduled, and that can be another 6 weeks at a time every time that happens. And then others, just for capacity reasons, have been waiting months and months.
So really interesting insight there from Robin about how she manages waiting lists on her ward. I mean, that's one of thousands of wards up and down the country. And what struck me was just what a jigsaw puzzle it is, you know, trying to match patients with available beds, but it was about so much more than that. She talked about, social care as well in trying to get waiting lists down. Siva.
Yeah, I think that's absolutely right. I mean, it may sound counterintuitive, but one of the things that can help hospitals with the flow of patients through a hospital ward is investing out of hospital. If you looked at those thousands of wards, I bet there's probably 30 to 40% of people on those wards who don't need any more hospital care. They don't need medical care. They're waiting for care outside of hospitals so they can go back to their own home or move to another care setting like a nursing home or a care home. Or there's services that we could put in place that would prevent us falling ill in the first place. So I think investing in adult social care, community services, primary care as well, are the sorts of things that in the long run will help the health service and help hospitals.
Yeah, Helen, how much does, putting a bit of power into the hands of patients, a bit of information for them to help them help get the waiting list down? Because it's all about, patients having a bit of power as well, isn't it?
Yeah, and there's two ways of looking at it. I mean, there's first of all, people on a waiting list. I mean, there's great research about people on waiting lists. What they need more than anything is to be kept informed what's going on. I mean, people like Disney have done great research on waiting. They're really good at keeping us waiting. Do you remember the lying in state of the Queen?
Yeah.
People queued for hours and hours, and they didn't murmur or mutter because they knew exactly where they were in the queue. They knew when the queue was moving forward. They were informed, valued, and they knew how the system was working. When people lose trust in a system, that's when it goes wrong, when people go off piste. So what we're seeing in the NHS as GPs, every day I get patients coming in who are frightened they've been lost to the system.
Yeah, because they're not hearing anything.
They hear nothing.
Yeah.
And we know that the technology is there. All of us get WhatsApp and text messages all the time from our delivery companies of when parcels are coming to our house, far too many sometimes. And yet the NHS frequently loses contact with people. We tell you we're putting you on a list, and sometimes a year and a half later you suddenly get a letter out of the blue saying in 48 hours you need to be in hospital and your whole life's up in arms. But in the meantime, you will almost invariably have made multiple contacts with your NHS, with general practice or your district nurses or whatever. So there's something about communication and using tools and apps to help there. But in terms of the empowering patients and prevention, there is so much we can do. My personal passion is about how we prevent ill health in the first place. A podcast about prevention being the new cure. And it's not rocket science. We prevent disease and we invest in prevention of disease. The whole system will benefit. There is a time lag in that, but it's just a no-brainer when you get down to it.
OK, well, thank you both. Still to come on this UK Tonight NHS special, we're going to be discussing the added pressures facing the health service this winter. And we'll get the take of our health correspondent, Ashish Joshi.
And I'm Sky's US correspondent based here in Los Angeles.
It's turning everybody into, a crazy, violent drug addict.
How are you feeling?
I am angry. Legal abortion!
It is an anti-woman agenda.
2 women say that you paid for their abortions. Are you a hypocrite, sir? Will your candidates win?
I hope so. I think they will. I think they're great candidates.
I gotta be realistic. My sister's dead.
More than 4 weeks on, there's no murder weapon and no suspect. Are you going to catch this killer?
We are doing everything we can.
Ghislaine Maxwell has pleaded not guilty to all 6 charges against her. Mum, how are you feeling today?
Jeffrey said, you answer to Ghislaine, you just don't cross her.
We're so excited.
Severe nightmares of these people coming in and just taking me in the middle of the night.
I've watched as whole towns were torn apart by natural disaster.
I'm alive and I'm thankful for that, but there are a lot of people who aren't.
It's not the winds people fear most here, it's the water. We take you to the heart of the stories which shape our world. Do you truly believe what you're saying?
A lot of cases that I know are reported from Ukrainian missiles themselves.
Ambassador, with respect, I think that's preposterous.
and welcome back to University Hospital in Coventry for a UK Tonight special programme on the future of the National Health Service. Now, it won't have escaped your notice that it is December, traditionally the time that pressures begin to mount on an already overstretched health service. The latest figures show that the number of people in hospital with winter illnesses, things like norovirus and the flu, is already creeping up. And health bosses have warned that there will be growing pressure on emergency departments this winter as the NHS faces the combined impact of cold weather, social mixing at Christmas parties, and of course a looming strike by junior doctors. Our health correspondent Ashish Joshi has spent the day here in Coventry speaking to people about some of those pressures.
That time again, I've just come to do your blood pressure if that's okay.
Robert's cancer was thankfully caught early, but to cut out the tumour meant losing a kidney.
Yeah. Are you sore anywhere? Have you got any pain?
A terrifying ordeal for Robert and his loved ones.
You do worry about the NHS now, although they've always been meat proud. But it is getting to the stage where, for some people, it is difficult and having to wait for months and months and months for an appointment. I was one of the lucky ones.
But thousands of other patients are likely to see their elective operations cancelled over Christmas. Junior doctors are set to strike again after pay talks with the government broke down. It's demoralising for patients and surgeons alike.
When they do come for their surgery, often their condition has worsened, and that means that the surgery is more difficult and the complications are more likely. And so it sort of feeds itself, really.
It's completely black and blue.
The disruption couldn't come at a worse time. Respiratory viruses and a struggle to discharge medically fit patients are putting the health system under strain.
The next 3 weeks will be particularly challenging with the junior doctor strike. That's tested us several times over the past 12 months, and our staff have stood up and risen to that challenge. But the next 2 or 3 weeks, we see some unprecedented strike action that will put our hard-working staff under even greater pressure.
The worry is that the winter season is only just starting. The pressure on hospitals isn't just seasonal. There's huge financial pressure too. There's the cost of living crisis, the price of energy, the money being spent on trying to address that massive waiting list. But it's the industrial action that's costing the NHS tens of millions of pounds. And that presents a real challenge for all NHS trusts.
The cost of the strikes does come out of what we call our revenue budget, the money that we have, and we are cognizant of that. We have to make sure that we are as productive and as efficient as we can be to try and mitigate some of that.
Robert will be at home with his grandchildren in time for Christmas, but he knows his care in the weeks ahead could still be disrupted. Ashish Joshi, Sky News in Coventry Hospital.
Well, as you heard from Ashish there, the winter season is only just beginning. Availability of hospital beds typically used as a measure of just how much pressure hospitals are under as the season goes on. Well, let's take a look at how things are faring so far this winter period. Well, in the week up to the 3rd of December, just 5.6% of general and acute hospital beds were free across the NHS in England. And if we take a look at how that compares to the same week in previous years, you can see it's pretty typical for this time of year, except, as you can see, in December 2020. That was, of course, during the pandemic. Well, Siva and Siva and Helen Stokes-Lampard are with me. Let's get into winter pressure, shall we, Siva? I think what I've been learning from my time here at the hospital today is that the NHS is operating within such fine margins when it comes to capacity that when winter comes, they really are stretched, and that's when you start to see the strain.
Yeah, absolutely. So during winter, a health service will face some pressures it doesn't face at other times of the year. You've got winter vomiting bugs, you've got seasonal flu, you've got cold weather that can make it more difficult to breathe if you have some sort of respiratory conditions. So all of that puts more pressure on the system, and you've got staff falling sick as well. But the one thing I'd say is a resilient health system can cope. A resilient health system can cope with that surge in demand, and that's unfortunately not what we have. We just simply don't have the excess capacity to deal with these surges, and that's why we have ambulances queuing outside A&E departments. That's why you get all these horror stories winter after winter in the NHS.
So, Helen, how do you mitigate that pressure? Is it simply providing more capacity? I mean, that sounds quite simple, presuming there's a reason why that doesn't happen every winter, because the same thing happens annually.
Yeah, I mean, let's face it, winter's not a surprise. It comes around every year. We get similar challenges, as Siv has alluded to. And in fairness to the NHS, massive planning has gone on, particularly this year. There's probably more planning than ever has happened. There more bed capacity has been created. In fact, they're just shy of 5,000 additional real extra beds across England, and about 10,000 what they're calling virtual beds, that are where people are enabled to stay at home, but with a lot of extra nursing and medical support remotely. So those things are good use of innovation and technology and planning. But what none of this is doing is magicking up additional workforce. It's not creating additional hospital spaces. It's not creating extra diagnostic capacity, and that's where the challenge is. And what we're frequently doing is we're asking staff to work longer hours, more shifts, and to do their best again and again. And people are getting worn out and run down, and that's a real challenge for the whole system. So money helps, space helps, but a commitment to all pull together helps. I mean, obviously, social care capacity is so stretched and so difficult, and I think we need to be very honest about what we can do. I mean, doing everything that people can to stay healthy and well. You know, people have really forgotten the lessons of the pandemic about reducing respiratory infections and staying away from one another when they've got coughs and colds. And let's face it, every icy day, we have a huge number of slips, trips and falls that mean many people end up in A&E. If they're elderly and frail and they have a fracture, they're admitted. If they're admitted, they often need to go home with social care, and so the pressures mount. So we have an all year round stressed system, but things do get worse, particularly late December and into early January when those respiratory infections peak.
Helen Stokes-Lampard and Siva, thank you for the moment. You're watching the UK Tonight at University Hospital Coventry for this special programme on the future of the NHS. Coming up, we're going to be discussing NHS staffing, the issues in social care, and I'll be speaking to the Chief Executive of this trust to find out what he thinks of the problems facing the health service. and welcome back to the UK Tonight, a special programme tonight dedicated to the NHS. We're here at University Hospital, Coventry and Warwickshire, which has over 1,000 beds and 26 operating theatres. Every year, the teams in this trust provide care for around 800,000 patients. Well, earlier today, I caught up with the Trust's Chief Executive, Andy Hardy, to talk about the pressures facing the Trust and its future. Andy, when we talk about the NHS and the help it needs, a lot of people come up with the same three solutions or inputs, and that is more money, more beds, and also better social care provision in terms of connecting it with healthcare more efficiently. Of those three things, what do you think is needed most, particularly when it comes to your hospital here?
The NHS isn't broken. It can always get better, and we strive to constantly get better. That's one of the things we pride ourselves here at this hospital. In terms of things you mentioned, funding, more beds, workforce, and social care, they're all challenges, but firstly we have to hold the mirror against ourselves in the NHS. We've got more funding than we've ever had before. One of the challenges we have is, are we spending every pound as effectively as we can? And I think one of the, going back to mention earlier, we have got better at working across systems, thinking about how we spend each and every one of those pounds. We're rightly challenged by the Treasury, always productive as we can be, and there is more we can do. I'm clear that whilst I'm proud of everything that goes in this hospital, there's waste in this hospital which we look to eradicate constantly, become more efficient with that money. But of course, we can always spend more money. That's an issue across the whole world. As people say, you can have a finite level of resource and there's an infinite demand for healthcare. So we really need to think about how we use all that money.
And morale within the NHS, what's that like? Obviously, we know that it's been a year of unprecedented strike action, more on the way. How difficult can that be to manage?
The industrial action has brought around some extremism in terms of comments that are made about the NHS and about where the NHS is, and that hasn't helped. In terms of the industrial action, obviously we're about to face a real challenge leading up to Christmas and then the industrial action in the new year, which I think is going to be the most challenging industrial action we'll face at all time because of when it is. When I said earlier that healthcare is quite predictable, I can safely predict that week after Christmas is always very challenging in terms of people turning up at A&E, illness, etc. And that's when we've got the next junior doctor strike. So I'm hoping that the VMA and the government can come together before then to, if not resolve the conflict, then actually at least have some meaningful talks so that doesn't happen. But if it does happen, we'll plan for it as we have done since now. It'll mean that a lot of the planned elective operations that would have happened in those days will not happen. So again, going back to the waiting list, we can't bring that down.
My final question, simple one really, is the NHS fit for purpose, and what does an NHS in the future look like?
Well, first I'll say that I cannot imagine a future when the NHS isn't with us in this country. It's so well beloved and by the population as a whole, but those of us who work in, we're very proud to work in the NHS. Is it fit for purpose? We'll always be able to find things that are not quite right. But we all know that at times of absolute need, the NHS is here. Sometimes in good times, they're only having babies, etc. But the NHS is here, it's here to stay. It needs to change, it needs to adapt to the way our population's adapting. We know greater demographics around age in the country. We need to think about how we do that. But again, we've got to think about not just health, we've got to think about health, social care, community care, and how systems work together. We have 42 integrated care systems in this country, and we need to focus on them, seeing how we can actually make pathways of care better. So is it fit for purpose? It's not as fit for purpose as I'd like it to be, but we're constantly getting better, and it'll be here to stay.
Well, it's only been a year of disruption from industrial action, hasn't it? Right across the health service. Staff from nurses to ambulance workers, physiotherapists to consultants have all gone on strike. And later this month, union doctors will be walking out once again in their long-running dispute over pay and conditions. With many of those groups now having reached deals with the government, doctors and radiographers have yet to come to a resolution. Well, NHS leaders have warned of plummeting morale and concerns about burnout, all set against a backdrop of persistent staffing vacancies. Let's take a look at the health of NHS staffing. As of October, there were more than 125,000 vacancies in the National Health Service. And in adult social care, there were even more, 150,000 vacant posts. Well, let's bring in our panel again now, Siva and Helen. Well, the workforce issues are well documented, aren't they, Siva? The big question seems to be, how do you recruit NHS staff? But should it be, how do you retain them?
Absolutely, yeah. I think if you're looking at the workforce pressures in the NHS and in adult social care, the two things you need to do are make sure you're training enough new staff and that you're holding on to the staff you already have. And unfortunately, there's a mixed picture on both of those. So there is now a long-term plan to grow the NHS workforce, train more nurses, train more doctors. We're still waiting for a plan for adult social care. There isn't one yet. And on retention, well, clearly industrial action shows that pay is one of the factors. It's not the only factor that affects whether people want to stay in the service. But the other thing is the conditions that staff are working in. So, you know, we're in what I would say is a really nice facility. But there are other hospitals, other primary care practices that the physical condition of the buildings is simply not fit for purpose. Why would you want to work in those conditions? Where things like hot meals, access to car parking, having a locker so your stuff isn't nicked when you come in for a shift, all of these things aren't in place. So I think there is a national policy angle to improving training and retention, but there's also a local employer angle if we're going to hold on to the staff we already have.
Helen, why would people want to work for the NHS at the moment? The headlines are so bad.
You know, you're right, and the headlines are dreadful, and Siv has talked about some of the problems, but, you know, working in the NHS is phenomenally rewarding. That's why people do it. We do this job because it's a vocation. I became a doctor because I genuinely care about patients and providing truly whole-person care. And people go in for all sorts of reasons, but the one reason that helps them stay, again, despite all the pressures, is job satisfaction and feeling valued, and it's that moment when a patient just looks at you and says, thank you. Thank you, doctor, or thank you, nurse, or thank you, physio. And those things, those are special moments, and you hang on to them. And in the dark days, that's what keeps us going. Also, the camaraderie, working with amazing, talented, caring, passionate people. And so our NHS is full of all those things, and it really is, despite all the awful stuff and the pressures. And if we can get the numbers right, if we can get the finances a bit better, the NHS is awesome at pulling through. So, you know, I can be glass half empty and glass half full, but we can do this. We have the public behind us. The public wants the NHS to succeed. They want it to remain as it is. And I really believe in it, but I also will fight for it as well. And I think we have, when we unite our voice to say this really matters, we will do this, and together we'll support one another through it. But that does mean that together we have to change the political narrative too. Politicians need to understand how precious the NHS is, how precious good health and health care is more widely. Social care comes into that. And then we can do it, because the people in it are what makes it fabulous.
Yeah, the people I've spoken to here today at the hospital, whether it be in catering or on the maternity ward, again, it's that real sense of pride, and you get a sense of why they want to work for the NHS. It really is a special place to work when you're in it. It's hard. It's very hard. But so rewarding. I think that's the message I've got today. Challenging, but very rewarding. But the people that are in the NHS, Siva, can't do it alone. There does need to be recruitment. The trust we're in today is lucky. You know, they don't have that many vacancies, but as you pointed out, others do. And some of that recruitment has to come from abroad. And that's been a real political hot potato, hasn't it, in terms of getting workforce in from abroad. I've got a question here on workforce issues. This is from Dales, who asks, what impact will the new immigration bill and the increased minimum salary requirement for immigrants to £38,700 have on the NHS? Because these changes coming in, Siva, will have an impact. What's your general view on those?
So we don't know in the long run what impact the changes will have. I would say a few things though. First of all, both the health and social care service are reliant on staff who trained overseas. You know, roughly 1 in 6 in both sectors of current staff trained overseas. So you can't run the service effectively without them. The second thing is, I'm probably more worried about adult social care, and particularly that salary threshold, than I am about the NHS, and I'm worried enough about NHS staffing levels. And to be honest, if you look at workforce shortages in the NHS, the pressure the system is under, I would be saying that you should pull every lever you have available to get more staff in, rather than trying to erect more barriers to keep them out.
It's interesting, isn't it, Helen, because the situation in social care isn't going to change. We are a different society now. You know, satellite families, you know, 2 working parents, people having children later, so they then get the double situation of childcare and looking after elderly. That is not going to change.
Absolutely.
So something's got to give.
Yeah, so the social care challenge is enormous. I mean, this sandwich generation you've alluded to, people who have children and elderly relatives to care for, whilst trying to hold down jobs because they need to pay for all the care either way. But coming back to the issue about healthcare professionals and social care from overseas, one thing that really worries me about the proposals is this idea that people will not be allowed to bring dependents with them. That's not allowed to bring their spouse or their children with them. And actually that's really difficult, because most of the amazing healthcare professionals I work with that come from overseas do have their other half with them, do have their children with them. And we're going to just turn off generations of phenomenally talented, brilliant people, the people who have helped the NHS exist. And I do think there are going to be consequences, and I think we need to be quite open about that and looking out for it.
Okay, Helen, we'll hold that thought, because we're going to talk about social care, because we can't talk about the NHS without mentioning it, but it is a subject that charities and campaigners say the government seems to be doing strikingly little about. Here's what Boris Johnson, then the Prime Minister, had to say back in 2021.
You can't fix the NHS without fixing social care. You can't fix social care without removing the fear of losing everything to pay for social care.
Well, last year plans to bring in a cap on how much people would have to pay for their care were postponed until 2025, leading some to say that plans to reform the sector had stalled. Social care too is facing a shortage of skilled staff, as we talked about earlier in the programme. And just this month, new government rules about migration have left many in the care sector concerned about their ability to recruit staff in the future. Well, I'm joined now by Professor Vic Rayner. She is the head of the National Care Forum, the leading voice in the not-for-profit care sector. She joins Siva and Helen. Vic, thank you so much for joining us. What are the major challenges facing social care at the moment?
Well, there's quite a long list. I know you've been through a few things already. I mean, workforce is absolutely front and centre of most care providers' concerns. And certainly it's about not just the shortages and the vacancies that are held each and every day within the care sector, but also about the numbers of people coming into care, the professionalism and the respect with which care is treated, and the fact that the skills and experience of those staff are not properly recognised within the salary levels that people can pay their staff. So workforce is definitely there. Funding is a really big issue. There's been a very significant squeeze on funding over recent years, and organisations are trying to cope with increasing costs and increasing complexity of care that people need within a very small financial envelope. And then I think that there are lots of concerns about what the future holds. Some opportunities there as well. So some thoughts about how technology can improve care, and some thoughts about how new models of care can be delivered. But we need to do that as part of a strategic partnership between health and care. And certainly from the care side, it doesn't feel that we've got that yet.
It has, perhaps until this point, Helen, I'll put this to you, felt a bit piecemeal, a bit like there's been a lot of talk about beefing up social care and connecting it, integrating it with health properly, but very little action.
Yes, absolutely. You know, at a micro level, the real front line where I work as a general practitioner, I'm in close contact with our local, whether it's our care homes, whether it's our care providers, but they are not joined up. I mean, care itself is not, we don't have a national care service in the same way that we have a national health service. We don't have unified digital records in care. We don't have standard ways of communicating with each other. So we're starting from a really difficult baseline, let's be honest about it. What's not in doubt is the passion and compassion of the people working in it. And there is absolutely the desire to collaborate and do things better, because on the front line, that's exactly what happens day in, day out. But it's how we translate that up through the system and how we get a national agreement and commitment to doing it properly. Because until we have a commitment to truly collaborative working, I don't see how we're going to get out of the predicaments that we're in at the moment. I think that is really one of the fundamentals we need to, which they've done in some of the devolved nations. You know, Scotland have come up with some very bold plans for doing things differently around social care, and we need to learn from that.
Madge has got in touch, and she says fitter patients are still staying in hospital too long because of a lack of social care. Isn't that where we should be spending more money? Siva, I'll bring you in on that, because, social care, people are still waiting for assessments, never mind actually, their care plans, having a delivery of service.
Yeah, absolutely. And I'd say that if you were to genuinely fix the adult social care system, which hasn't happened yet, you would see a benefit to the NHS, which I would say is almost a side benefit. You fix the adult social care system because it is a system in its own right that people use and need. And I would say, you know, there's some big problems in the world that are policy problems. We're not sure exactly what the solution is. This is a political problem. I mean, broadly, I think most people would say that you need some form of risk pooling, like you have in the NHS, where people aren't exposed to the absolutely catastrophic costs of care that you might, through just bad luck, incur. So that we need some sort of national risk pool. Now, how exactly you do that with a cap on care costs or all of that, I think there's a lot of thought that's gone into. What we're lacking is a government of any hue that will actually grasp the nettle and say, we are going to do this.
That's really interesting, because the answers are out there, the solutions are out there, we're talking about them now, they're not secret. Why is it they're not being started upon, let alone implemented?
Yeah.
Is it because it's too expensive? Is it because the problem is too big? And the political cycle, as we know, it's such a long-term plan to get social care where it needs to be. Is that the crux of the matter?
Well, I mean, I think we absolutely need lots of people to speak up for care, because it is a fundamental part of so many people's lives. So if you think about the population that is directly impacted by social care each and every day, you've got 1.6 million people working across the care sector. You've got approximately 2 million receiving regulated care on a day-by-day basis. You've got 10 million unpaid carers, and you've got a whole host of other people who are receiving unregulated care through the voluntary and community sector. So if you look at the whole size of the electorate, nearly half of it on a daily basis is affected by care. And yet politicians seem able to say that this isn't an issue that is coming up on their doorstep. So everybody out there who is affected by that really needs to speak up for care, to make sure that we get the same set of focus and the same set of political priorities on addressing the challenges of social care as we do on the NHS.
And Siva, just a question, you know, as we said, workforce spills over into social care. The two are very much interlinked. What does the future look like if it's going to make it difficult for people to come into this country to support the social care system? What does that look like if it's made more difficult?
I think that looks like the shortages and vacancies we already have becoming a permanent feature of the system, and you will absolutely feel it in the services you receive. It will be longer for an assessment, it will be fewer care hours, it will be shorter visits if you're receiving home care. So to put it bluntly, you'll receive less care and poorer quality care because it's constrained by how many staff are staying in the system. So that I would absolutely agree with Vic. That is one of the major concerns we have.
Well, coming up on this UK Tonight NHS special programme, we're going to take a look at potential solutions to the problems that we've been discussing that face the health service and asking if it is time for drastic action to save it.
We found her name on his list, and Vera is here with us tonight. Hello, Vera. Hello. Now, I should tell you that you are, in fact, sitting next to Mr. Nicholas Winton. Hello. Hello. Thank you.
Well, that's when my grandfather was meeting a lot of those children that he had rescued for the very first time, and somewhat ambushed by it, we should say as well, was not expecting it.
He was in the audience, in an auditorium, and they all stood around him.
About a young
Exactly.
man.
They said, anyone whose life has been saved by Nicholas Winton, well, Nicky, please stand up. So my grandfather was living in London as a stockbroker, but in 1938 he travelled out to Prague, saw a huge amount of refugees that had escaped from the Sudetenland after Germany had invaded, saw them living in awful conditions. He decided something had to be done. People were already working to bring politically active people to safety who were in threat of the Nazis. But he said, I must do something for the children, and began to organise with others a large number of trains that brought children out to the UK.
I remember the Germans occupying Prague in March 1939. We had to tear a picture of the Czech president out of our school books and stick in a picture of Hitler. My mum was refused permission to leave at that point, but she got me on a Kindertransport train, and I can see her standing there on the platform at Prague station, German soldiers with swastikas in the background, and off the train went. I was 6 years old, I was one of the youngest, and it took 24 hours to get to the Dutch border. The older ones cheered because we were out of reach of the Nazis. I was looking for windmills and wooden shoes, couldn't see any. And then we got to Hook of Holland, Harwich, and then to London.
Did you see your mum again?
Yes, she actually managed to, having been refused permission to leave and thrown down the stairs at this Gestapo office, she managed to get out at the last minute. So I did, yes.
I'm Martin Brunt, and I'm Sky's crime correspondent.
Welcome back to the UK Tonight and our special programme on the future of the NHS from University Hospital in Coventry. Throughout the programme tonight, we have been discussing the challenges our health service is facing. Waiting lists at record highs, persistent staff vacancies and the prospect of yet more strikes. The system, it seems, is in crisis, with people struggling to access the care they need. And public satisfaction in the NHS has fallen to its lowest level since records began 3 decades ago. So, after 75 years and with a general election on the horizon, is the current model broken? Is it time to look for radical alternatives? Well, we're going to get a final word from our panel, Siva Ananda-Siva from the King's Fund, GP and Senior Health Leader Helen Stokes-Lampard, and Vic Rayner from the National Care Forum. So, let's get positive, let's look at solutions. We talked about some of the changes that can be implemented, but is it time for a radical overhaul of the NHS? Is there a system that would be better suited for the society we are now? Vic, I'll come to you with that nice, easy one.
Oh, thank you. Thank you so much. So is there a better system? So I think there's a number of things that we could change. I think, firstly, we need to have a proper integrated health and care system, and that means a strategic role for social care provision at the top table. Because of the discussions we've been having about delayed discharge, the problems around winter pressures, if we have social care there as a proper strategic partner, that will change some of that narrative, change the opportunity, and allow that sort of future focus to be put in place. And I think there are other things that we have to look at in terms of the workforce shortages we're facing and many of the kind of changing needs, which is around how we properly invest in technology and training and development for the care workforce, so that they can support people to live as independently as possible through some additional investment in that technology and the future.
It's interesting, isn't it, Siva? We've heard so many positives about the NHS. And in fact, talking to the Chief Executive of the Trust, he was saying, actually, they took a lot of positives out of the pandemic about virtual wards, about the use of technology and an updated way of working, and they were forced into that, had to be sped up. So there are positives in the NHS that are being moved forward. What do you think that the NHS will look like in the future, or what should it look like?
So I think you can already see some signs of what the future of the NHS would look like. So you already said use of technology. I think, there's some parts of the country where technology is being used to move skills and people. So, I was talking to someone from another healthcare system where they see in the next 5 years, a little bit like Star Trek, you could have a clinical professional beamed into your home to offer you advice. So that I think is a sort of thing on the horizon. The other things may sound more boring, but I think can have as great an impact. And one of them is collaboration. So I would say even as recently as 5 years ago, through a bad winter, a hospital like the one we're in right now would be trying to poach staff from other hospitals to try and improve its own performance. that type of culture is being completely modelled out of the system. I see more sharing of resources than at any other point I can see or I can remember in my career. And probably the third and final area where you can see the future is a focus on prevention. Again, I didn't think I would be talking to finance directors of hospitals who were saying, well, how could I use some of my budget to invest in preventative services, services that help keep people well, things like smoking cessation clinics, if I have more resources than they do. So technology, collaboration, prevention, I think are some positive markers of the future.
Yeah, it's good to know that a lot of that is already in the system. It just needs to be pushed forward. What about you?
So certainly would pick up on your final point about prevention. I mean, so for me, the community focus, we think of this as a triad of the hospital-based care, social care, and primary and community care. And that triad has to work together and be communicating. So I'd echo what you both said. The prevention piece, of course, has to underpin it all, because without preventing, we are just storing up additional problems for the future. I would also say about taking a much more whole-person care approach to what we do to care. Unfortunately, a lot of the way the system has been set up currently takes people apart. We break people down into disease silos or body part silos and give them care there. We forget about the totality of the individual, their place in society, the social, socioeconomic factors affecting them. Somebody who lives in a cold, damp home, who is in a dysfunctional relationship with poor income, will do far worse in any health outcome, irrespective of their illness. If they get exactly the same injury as somebody in a warm, loving home with a reasonable income, the difference in their progress through disease is massive. We know all this. So if we help those wider bits of society, that in turn will help the disease prevention, which will in turn help the NHS. So it's actually taking a step back, as many other nations in the world have done, take the bigger picture approach to health and care, and recognise that people are so much more than the sum of their body parts, will also really help us. It sounds a bit idealistic, but everybody in the health system gets it. We get it and we want to do it, but it does need some quite big political will to make that step change happen.
Okay. Well, Helen, Siva and Vic, thank you so much for joining us on this special edition of the UK Tonight. That's all from us for now. You can catch up on the highlights on our webpage. You can scan the QR code that is on your screen, and we'll see you tomorrow night at 8 o'clock.